Hello YouTube, I'm Dr. Fox. Today, I'd like to talk about cancer treatment and female fertility. Often, being treated for cancer can impact girls and women's fertility. If you need cancer treatment, your doctor or oncologist may talk to you about any effects this treatment could have on your ability to have children naturally. If the issue of fertility does not come up, it is a good idea for you to bring it up, or if the cancer patient is a child, for her relatives to bring it up. The impact of cancer treatment on the woman's fertility is not just about the type, dose, and length of the treatment and the type of cancer being treated. It also depends on things like the patient's general health, how long it has been since the cancer treatment was stopped, how old the patient was when they were treated for cancer, and the state of their fertility before treatment started. If you are going to be treated for cancer and may want children one day, it is important to talk about what treatment may do to your ability to have kids. For example, you may wish to know whether there is a risk that your treatment will make it impossible for you to have children in the future, or will make it difficult to fall pregnant or carry the baby to term, that is, to have a full-term pregnancy and healthy birth. Perhaps there are other treatments that won't harm your fertility. Alternatively, the hospital you are being treated at may have fertility preservation options that could help you to still get pregnant even if your cancer treatment causes infertility. Your oncologist could recommend another facility that offers these services or put you in touch with a fertility specialist. Could any negative effects that treatment may have on your fertility go away after a certain amount of time, and how long may it take for you to become fertile again? Finally, don't forget to talk about birth control and what type of birth control is recommended while you are receiving treatment. Okay, next, let's talk about the cancer treatments that can damage fertility. If you have cancer, being treated will be essential to potentially get you back to good health. However, cancer treatment can damage the glands that support fertility and your reproductive organs, and sometimes this damage can be permanent. Again, speak to your oncologist about what is right for you and what the effects of your treatment could be. Several types of cancer treatment can harm a woman's fertility. Firstly, there is chemotherapy, particularly treatments using alkylating agents, which can cause primary ovarian insufficiency or POI, where the ovaries stop releasing estrogen and eggs. POI is not always permanent, and your fertility and periods can get back. However, sometimes the damage done to your ovaries will not correct itself and you will be infertile permanently. Moreover, POI can cause night sweats, hot flushes, and vaginal dryness. It can also make you irritable, and your periods may be irregular or may stop completely. Chemotherapy drugs can also reduce how many healthy eggs a woman has in her ovaries, and the closer a patient is to menopause, the bigger the risk that chemotherapy will make them infertile. Another common cancer treatment is radiation therapy. Whether this type of therapy affects a patient's fertility depends on the position and size of the tumor it is applied to. If radiation is carried out near a woman or a girl's spine, abdomen, or pelvis, it can damage the reproductive organs which are nearby. A barium shielding or a surgical procedure that moves a patient's ovaries away from the spot where they will be getting radiation therapy can protect the ovaries. Additionally, if radiation therapy is carried out on the brain, this could damage the pituitary gland, which is important to fertility. The pituitary gland sends the ovaries the signals they need to make estrogen and other hormones that activate ovulation. Moreover, if a cancer patient gets a stem cell transplant, like a peripheral blood stem cell transplant or a bone marrow transplant, they will also need a lot of radiation or large doses of chemotherapy, which, as discussed, can harm the ovaries and result in infertility. Sometimes cancer will require surgery. For any cancer affecting a woman's reproductive system, surgery in the area of the pelvis can damage the reproductive tissues found nearby, scarring the tissues and negatively affecting fertility. Surgery's impact on fertility will again depend on the position and size of the tumor being treated. Finally, endocrine or hormone therapy is also used as a cancer treatment and can interrupt the menstrual cycle, impacting fertility and also potentially causing night sweats, vaginal dryness, and hot flushes. While these are the most common forms of cancer treatment, targeted therapies and immunotherapy may also be used, and they may have a different or no effect on your fertility. So, talk to your oncologist about all your options. Okay then, let's talk about the emotional impact of dealing with the fertility issues caused by cancer treatment. Cancer is scary, but for some girls and women, the long-term fertility problems caused by cancer treatment can be the most devastating part of the experience. When someone has been diagnosed with cancer, particularly a child, whether they want children is usually not at the front of their mind. Nonetheless, it is beneficial to talk about fertility with a doctor, oncologist, or fertility specialist to make sure you know how cancer treatment will impact your ability to have children and the options for preserving fertility. Okay, a lot of people want to have children, but having a child naturally is not the only way to make a family. Your healthcare team is there to support you, so don't hesitate to get in touch with them to talk about your worries and ask them any questions you may have. You may also wish to contact a targeted support group. If you have a young daughter or want to talk to her and her doctor about fertility and cancer treatment, hopefully this video helps you know where to start. Okay, last, let's talk about preserving fertility. Girls and women undergoing treatment for cancer to have some fertility preservation options, which may be offered by the hospital providing their cancer treatment or by a specialist facility. Your doctor will be able to recommend fertility options for you that consider your cancer type, the treatments you will be receiving, and your age. Fertility preservation options vary in terms of how successful they are and their availability and cost. One option is embryo cryopreservation or embryo banking, known more commonly as embryo freezing, where eggs are taken from a woman's ovaries and then introduced to sperm in the laboratory. If the egg is fertilized, an embryo forms and is frozen so that it can be implanted in the woman later. A newer procedure is egg or oocyte cryopreservation, or simply egg freezing. This process involves removing eggs from the ovaries and then freezing them. Later, they are slowed, fertilized in a lab, and then the resulting embryos are implanted into the woman's uterus. Instead of removing eggs from the ovaries themselves can be protected using ovarian or gonadal shielding. Ovarian shielding is designed for cancer patients undergoing scatter radiation. By putting a protective shield on the outside of the patient's body over their reproductive system, their ovaries and other reproductive organs can be protected. Ovarian tissue cryopreservation or freezing is for young girls who have not reached puberty and thus have immature eggs. In ovarian tissue freezing, part or even all of the girl's ovary is surgically removed and the ovarian tissue, which contains the eggs, is frozen. At the appropriate time, the tissue is thawed and surgically reinserted into the girl. This process has resulted in a few pregnancies, but it is still seen as experimental and is only used in the case of certain cancers. Another way of protecting the ovaries during cancer treatment is ovarian transposition, where the ovaries are repositioned so that they are far enough away from any area of the patient's body that will be receiving radiation therapy to not be damaged. This surgery can be done using the laparoscopic technique or at the same time as the patient's cancer surgery. Women in the early stages of cervical cancer who wish to have children may be offered a radical cervicectomy, otherwise known as a radical thoracilectomy. This is an option where the cervix, the upper area of the vagina, and the lymph nodes nearby are all removed and the uterus is attached to what is left of the vagina along with a special band that acts as a new cervix. Finally, patients can be treated with a substance called gonadotropin-releasing hormone agonist, which stops the ovaries from producing progesterone and estrogen. This may protect the patient's ovaries, but studies are still being done to prove these benefits. Wherever possible, and if this is important to the patient, oncologists, doctors and fertility experts will work alongside each other to come up with a cancer treatment plan that can help female cancer patients to preserve their fertility. Okay, thank you for watching. See you soon.